good afternoon. I'm Dr. Zachariah here with Genesis Medical Center. Hope you're having a wonderful summer and that you and your families are staying safe in this uncertain times. We hope that everything is going well for you and that you're taking care of yourselves and your loved ones. And today we wanted to just cover basic things about this new Delta virus that has come about and has taken over society and has increased the number of cases for COVID in those states, especially that have lower vaccination rates. And even we hear of the breakthrough infections of vaccinated people as well. So it's very important for us to consider, take a wider look of what has happened and what has brought us to this junction at this point. And now we can kind of strategize on how to live the remainder of our summer in a safe and wholesome environment for ourselves and our families, as well as getting ready for the school year that's about to come up. I know some facilities, some states have started their schools, but others have not yet. And we're in the middle of August, end of August, beginning of September. A lot of the schools are going to be reopening for in-person instruction. So this is a main concern to a lot of our viewers who have children, and children have not been vaccinated yet. And at this point in time, I think it's safe to say 50% of the U.S. population has been vaccinated, meaning they at least have one or more of the shots for vaccination. And it is very important for us now that we know that this Delta virus is present. It's double the deadliness and double the transmission. The transmission rate is 5 to 6 times more than the regular COVID-19 strains that we were used to. And as things have opened up and mask mandates have gone out the door, we are seeing a lot of transmission of this virus. And fortunately, the people who have the vaccinations, the rate of infection is about 1 in 1,300 of people who have the vaccination, and those who don't, it's 1 out of 10. So this is staggering information where it tells us that if you're not vaccinated at this point, this would be a very, very opportune time to go and get your vaccinations. There was a lot of vaccine hesitancy, and there was a lot of waiting to see data, to see different types of outcomes. But from what we've seen and what we have in terms of the data, and if you go to the CDC or the World Health Organization or your state health authorities or your county authorities, by far vaccines are saving lives. And today, what we have are unnecessary hospitalizations and unnecessary deaths due to COVID, which can be preventable if people get the vaccine and get on board. It's very important to do that. This is not a matter of politics anymore. It's not a matter of, you're being on the right or left. It's a matter of just being, conscious and cognizant of what's going on. The vaccines have been administered for the last year and a half now, and we haven't seen those crazy side effects where the conspiracy theorists have warned you about. Those things have not happened, and people are actually doing well. Even those breakthrough infections, the people that get it, they get a mild cold. They'll get some issues, but they're not hospitalized, and they're certainly not being put on ventilators, and they aren't succumbing to COVID at all. So this is very important. And I think someone mentioned, the tragedy of our time is that now we have worldwide, we have more than 10,000 people dying a day from a preventable and a virus that we have a vaccine for, but they're still dying because they haven't got the vaccine. That is the unfortunate part, And as far as we see in terms of the states here in the United States, all the states are now looking to mandate masking again, and they're having rules for vaccinated people and unvaccinated people. So it's very important that we make this a health issue, and that's what it is. It's a public health issue. There's no issue of politics or anything else. Please get yourself and your loved ones the vaccine, and we want you to enjoy life. I don't think there's going to be any major lockdowns coming up, but that's provided that the numbers don't get so high that we have, and these numbers are getting very high among the unvaccinated, to be honest. If you look at the states of Louisiana and Alabama here in the US, their ICUs right now are packed. They don't have ICU beds. They're referring people out to other counties and taking them down. And the other unfortunate thing is that in those states, 20% of the infections are now in children, because the children are the ones that the vaccines have not been approved yet for. So the adults have to be responsible and protect your loved ones at home. It's very important to protect them. You understand that your children do not have the vaccine, and they are susceptible to this Delta virus and the Delta variant of COVID virus. So if you know that, it behooves you as an adult, as a parent, as a caretaker, to take care of yourself by getting that vaccine. And you get it not only because of yourself, but you get it because of your children, because your children are not protected yet. 12 and under, there's no approval of any vaccine yet. They're still waiting to get the final approvals and to start administering that. So if they're 12 and under, you have to protect them. Number one way to protect them is when you go outdoors and to any places outside your house, you mask up. Masks will protect them. Mask them up and mask yourself up. It's very important. You could get asymptomatic transmission. People that are vaccinated can get it, and they can transmit it, but they themselves will be asymptomatic. So that's something that you have to be aware of. If you're not going to do it for yourself, do it for your children, do it for people in your society that are getting, that are more vulnerable. And, this, before we used to say that, yes, the children, it doesn't thrive in children, but this Delta variant is thriving in children, and it's causing hospitalizations. Again, 20% of the infections in those states that are high unvaccinated rates, with like Louisiana and Alabama, and these places are of children. So this is very important for us to realize. And those of us who live here in Southern California, fortunately, we have a good number of people vaccinated here, but it's still, it's not above 50%. So we need to get our colleagues, our friends, everyone on the vaccine wagon so that they can be safe. Aside from that, now we have schools opening, and a lot of the schools are sending emails and preparatory phone calls for the children to come back to class. And they're all taking precautions. And either if it's a middle school and they're 12 and over, again, for 12 and over, there are vaccines available. You can go to your local pharmacy, Costco, Walmart, Target, wherever that's close, and get your children vaccinated if they're 12 and over. That is something which is a no-brainer at this point. A lot of people have this hesitancy, and they've heard that, oh, the vaccine might cause infertility. This is categorically untrue. These things should not be followed, and the science is very clear. These are vaccines that teach your body to present a antibody to COVID-19, and that's all they do. There's no other. The minimal side effects, yes, you get some soreness at the spot of the vaccine. Some people that are more sensitive might get a little fever and a little aching, but other than that, there hasn't been any major issues. Even the myocarditis, which is an inflammation of the muscles of the heart, even that was minimal compared to the efficacy and the decrease in risk of hospitalization and death with the vaccine. So it's safe beyond looking at these numbers. The risks are negligible and the benefits outweigh the risks by far, by far. So it's very important for us to do that, especially now that the children are going to go back to school and they're going to be in an environment where they can transmit the virus if anybody's a carrier. So these things are important to consider. If you do have further considerations, you can call the school. The school usually has a plan. Nowadays, it's become very fashionable for schools and big businesses to have COVID coordinators. They have COVID coordinators who take care of all aspects of safety, living with and functioning with COVID in society. So they plan for everything, and they have a plan that they can illustrate to you or they can share with you, so that you can your mind can be at ease. But that's their part. They're doing their part. The facilities, the schools, the districts, the counties, they're doing their part. But we as individuals have to do our part. Our part is very simple. We need to get that vaccine and make sure that we don't end up on with COVID-19, the Delta variant, and in hospital, or God forbid on a ventilator. This is happening daily now, and it's unnecessary. This is the major tragedy of this. It's not that COVID's here. The tragedy is that it is preventable, and people are not taking responsibility to go and get that vaccine. In New York, I just read that indoor dining, indoor businesses will not entertain you if you haven't been vaccinated. So states and businesses are starting to mandate that people get vaccines and come. Facebook, all these big companies are mandating for their employees to be vaccinated because people want to live and be in a comfortable place. We don't want to be in an area where we know that these are unvaccinated people, and they're number one, they're vulnerable to the virus. Number two, they can carry it and get sick and infect others very quickly. So the vaccines prevent, again, as I mentioned in the beginning, currently 1 in 1,300 people that are vaccinated get COVID, and 1 out of 10 that are unvaccinated get COVID. So you can see the big divergence, the big difference. 1 in 10 is 10%, whereas 1 in 1,300, negligible. It's very negligible. So I think that the numbers are there, the facts, the data are there. It's some people are not, they don't trust the science, but if you're getting the science from multiple different sources, it's not just US sources, it's not just World Health Organization sources, it's the data that you see. You see, unfortunately, there are countries that don't even have vaccines availability right now, and they have COVID rampantly raging in their society. And then you see other states that have high vaccine rates. They have low infection rates, low hospitalizations, low death rates. So the correlation is very straightforward. You don't have to be a rocket scientist or a mathematician to see the benefits. It's time for everyone to become responsible and stop holding, especially if you have loved ones that are children or elderly. It's very important to curb this Delta variant. Again, Delta variant is multiple times more transmissible than the regular COVID-19 virus, and it's also more severe in its clinical manifestation. So this is something which is in our control, that we can do something about it, and it's time that we do that. Fortunately, in the last 2-3 days, there's been an uptake in vaccinations, which is good, especially in those states that were like below 30% vaccination. There was like 6 or 7 states in the southern United States that were below 30%, and now the numbers of the percentage of people trying to get vaccinated has increased over 150%, which which is good. Even the politics of it are changing. The other thing, again, to protect children, it's important that they mask when they go out and they're in areas where there's strangers and they're not with their family. And if specifically if you know that there's unvaccinated people around, you definitely have to mask up. It's very important because you don't want your child to get this strain and suffer with it, you know. And then you also have some long haulers where there are people that got COVID, you know, 7 months ago, 6 months ago, 9 months ago, and they still have symptoms. And unfortunately, these were most of them, 99.9% of them were unvaccinated people that got it. And these long haulers, because they have other underlying conditions, they still have symptoms now. So it's become a chronic disease for some of these people, and we don't want that to happen to our children. We don't want that to happen to our elderly. And now, as you see, the in the Middle East and Israel, they're starting their third boosters, or their third booster for people 60 and above. So that's another thing that Pfizer and Moderna are considering here in the U.S. And although the World Health Organization does not push for that, the World Health Organization is saying that if there are boosters available and there's enough vaccines, let's give it to the second and third world countries first, so they at least get one dose. That's very important. But here in the West, where capitalism reigns, they're talking of a third booster shot for people that are immunocompromised, people that have other underlying conditions, as well as the elderly, 60 and above. They're talking about getting them the third booster. And I think they'll include healthcare workers in that as well, where because of the ferociousness and the severity of the Delta variant, they're pushing for that third booster, the third shot, or the third booster shot, which will, I think, maybe this fall they'll roll it out. That's something which is happening. And also, if you have a loved one in the hospital, or if you had someone that has COVID, it's not the end of the world. You have to get them proper treatment. And if they're hospitalized, make sure you ask the hospital to give them monoclonal antibodies. Sometimes some of these studies won't give it to them, depending on different criteria, but you can advocate and push for it. And there was a gentleman right now in San Diego that got hospitalized, and he's gone back and forth. He's got pneumonia, COVID pneumonia, all that. And, you can push for antibodies, the monoclonal antibodies, which will help. It's the same treatment that Trump got when he went from Regeneron. And there's 2 other companies that do that too now. So those are things that you need to look for. You need to advocate for yourself. You need to stay safe. You need to be aware of what's going on. No reason to panic, no reason to be nervous about these things or cause anxiety, but it's important to act with determination and with knowledge, and follow those who are experts in the field. Don't follow outliers. A lot of people find a doctor or some person that says, oh, you're good. Don't get the vaccines, or the vaccines don't help. These things are unanimously rejected by the majority of the scientific community. So don't follow outliers. Don't follow people that are the exceptions to the rules. Follow the mainstream science and what it tells you, because mainstream science is looking at all the data, not just a particular exception or something that's off data. It's important to do that, and that way you protect yourself, your communities. In terms of congregational gatherings, it's very important now that, I would definitely practice social distancing and masking, if nothing else. If you're out there and you don't know who's who, and you don't know if they're vaccinated or not, and there's high traffic areas, like you go to your mosque or your church or synagogue, or you go out to shopping centers that are crowded, I would definitely mask up and protect yourself. And I myself, I try not to take my children to outdoor shopping areas in terms of like indoor warehouses and shopping centers, like things like that. I don't. I try to keep it all outdoor because that's safer right now, and it's very important to practice precautionary measures. And if we all do that, then this thing will be behind us, and we'll all be able to go and enjoy society and outings and our surroundings. But if we are still hesitant and don't get vaccinated and don't take all the precautions, then we're giving more life to the virus. I hope that people take it seriously and really get on board. And if you have any questions, you can comment on the comment section and we'll get back to you and we'll give you answers. But it's very important to keep that in mind. COVID-19 is here. It's not going away quickly. So we need to learn how to live with it in a cautious and safe way. And we need to protect the most vulnerable in our societies, the most vulnerable. That's the important thing. So it's whether you have your kids, like sometimes I'll go with my children and I don't have to mask. I'm double vaccinated and I'll just mask because I know my children are masking so they don't feel bad. I mask because of them. And I put my mask on and we'll go to in a place where there's outdoor crowded event, we'll go to it, but we'll mask up because I know that my children need to mask up to protect themselves. My children who are above 12, we've already got them vaccinated. So that's the thing to do. What you want for yourself, you want for others, the golden rule. So please consider that and look at this whole thing as a public safety issue. This has nothing to do with personal views, personal agendas, politics, anything like that. It's a public safety issue. Please get yourself and your families vaccinated who are eligible and use precautions, use masks so that we don't get this huge surge coming up here in the fall and that we protect ourselves and our families and our communities. And if you have any concerns or questions, hesitate to comment and reach out to us and we'll get back to you as soon as we can. With that, I'd like to wish you a wonderful week. Stay safe, stay smart, and take care of yourself and your families and your children and your elders and yourself. We'll see you next week. Thank you very much.